Peace be to you. This is Elmar Abdul Malik, physician assistant and health educator. A beautiful skyline. So I'm commuting 5 foot or not actually running. I think this is more like a walk, cross between a jog and a walk. But anyway, I wanted to continue along my series of how to thrive on your rotations. Those of you guys that are PA students or even medical students. So I covered internal medicine, pediatrics, and surgery. So I'll talk about OBGYN. So of course, obstetrics and gynecology. So my list of things that I review certainly is not comprehensive, but it is, you may find those things on it. Now, before you start your OBGYN rotation, of course, you'll have taken your medical course during your didactic phase in OBGYN. So you should be familiar with a lot of the concepts, at least on a student level. So things like, women's health, let's see, stages of gestation, different pathologies. A lot of things go back to your pathophysiology. If you're dealing with endometriosis, fibroma, fibrotic disease, understand the pathophysiology of that. When you're on your OBGYN rotations, understand that depending on your locality, where your school is located, and the amount of places where you can go, you all may have differing, markedly different, you guys may have markedly different experiences on your OBGYN. So, for instance, I did very little obstetrics on my OBGYN rotation because the doctor with whom I worked he was a fertility specialist. So I did more along the lines of sitting in with him as he counseled couples, if they were getting things like IVF, in vitro fertilization. I did a lot of pap smears, and I had an interesting experience. There's a group of nurses, I don't know if they're still around, but this amazing group of nurses that actually volunteer to show people how to do vaginal exams and pap smears. So it was a weird experience as I was doing that training, because they're sitting there with their feet. These nurses, a nurse is sitting there with her feet in the footrests. We don't call them stirrups, and she's guiding me along how to do a pap smear on her. So leave that to your imagination. But no, in all honesty, it was in the presence of my classmates and I. So we were in training. And I'll tell you guys, I see a lot of you guys posting your Instagram pictures practicing on these latex models. The human body varies markedly from those nice, neat latex models. It's like looking at an atlas of netters and thinking that's what the body actually looks like inside, until you get a cadaver or you actually do a post-mortem procedure. There's all sorts of idiosyncrasies in our body. So, for instance, with women, so some women have their uterus, or uteri, I guess, is positioned differently. So you may actually have to do what's called a ballottement, where you're pressing down in over the pubis symphysis to try to get to try to visualize what's called the os coxa, and which is the opening of the uterus. So anyway, the nurse was like guiding me how to do that, how to use and use the swab, and use the there's a brush that you use in order to go into the os coxa to get a sample of cells to do your pap smear, with which you do the pap smear. I would issue this caveat when you're doing a pelvic exam on a woman. Well, I don't know who else would you be doing it on, but be sure, especially you guys, you men, make sure that you create kind of a safe space with a woman. Ask her if she's okay with you doing the pap smear on her, or a vaginal exam on her. Make sure that you have a female medical assistant in the room with you at all times. What I would do is I got very good about telling the woman, like, look, if at any time you feel uncomfortable or I cause you any pain or discomfort, just tell me to stop, and I'll stop the exam. I had a couple of patients, actually a few, that had been, unfortunately, had been sexually assaulted. And, so they weren't comfortable with men working with them. They were comfortable with the doctor under whom I worked, because he had been working with them for years. Here I am, this young student working with them. But I got pretty good at doing those. Also understand, jumping around a bit, sorry. Understand the different stages of development in women, so adult women, so perimenopausal periods, no pun intended, elderly, we have a burgeoning geriatric population, so there's issues there. There's postmenopause, there's drying of the vaginal tissues, which can make sex very painful for them. Dyspareunia, or even just urinating and things like that. So you could offer things like exogenous estrogen, estrogels. You need to be educated about that. How much time do I have? I've got 3 minutes. So my experience with this OBGYN guy was I did very little obstetrics. I think I did one fundal height measurement during the entire rotation. I helped do a total hysterectomy, which was kind of interesting. Realized, made me know I didn't want to do surgery. And I helped to do a lot of cerclages and remove. Oh, I think I did one. I think I did one cerclage. That's where you do like this purse string suture. I'll talk about that later, maybe. Later. I helped remove uterine fibroids during surgery, and then really was an educator about the differences between fibrocystic disease, fibroadenomas. Those are things you just definitely have to know. Be a sensitive type of person. Women come in with finding a lump in their breast. They're like, oh my God, I'm freaking out, I got cancer. Hell no, you don't necessarily have cancer. First, we got to do some more exams. So you should know what those exams are. Let's see, what else? So much stuff to know with OB-GYN. You may have know when there's an emergent issue or an emergency issue. If a woman comes to your clinic and she has maybe an ectopic pregnancy, that's an emergency. You may have salpingitis. There's bacterial infections, not necessarily brought by STIs, sexually transmitted diseases. So you just do a lot of counseling with that. But it's really rewarding. So there's overlaps again. There may be overlaps with surgery, internal medicine, and I think emergency medicine, maybe even some psychiatry, depending on your patient. So that's the fun stuff of your training. So I know I jumped around a lot. Find whatever book works for you in terms of your OBGYN. Let that rotation develop you. You may find that it's really your calling. There's a couple of PAs that have really established themselves in the women's wellness market, the niche. But I hope you guys found this useful. I ramble a lot, like I do with my running. Okay, so I'm open also to looking at people's personal statements for their CASPA. And I finally found a doctor that's agreed to let me have students shadow me in his clinic. So if you're in the DC, Virginia, Maryland area, we can work that out as well. Okay, I wish you guys the best of success in your positive endeavors. Take care. Peace.